connection to country is our physical and our mental and our spiritual connection. Physically, we've got to be on the land, we've got to touch the land, we listen to the land, we get the healing from the land as well.
Just when I realized who I was, and where I come from, that's my country.
We're rich. If you're a country, you're a rich person. And there's a myriad of different things that are happening to Indigenous people. I have family that get dialysis machines for their kidneys, problem with diabetes.
One of the things I hear a lot from patients is that the more complicated their health is, the more times they've got to tell their story. And so when they might be seeing a specialist, followed by their GP, followed by a nurse and a health worker, and if that person gets asked that question every single time, they begin to wonder if you're really listening.
All they do is get somebody to listen to them at a certain level where the person that they're talking to can understand what the questions are.
So us as Aboriginal people, we always want to know who's your mob, where are you from, and what are you here for? Because what's important is building that relationship, respect and trust. You can't just go in and start talking about the clinical care.
As we know, the population group is quite small and everyone seems to be interconnected in some way, whether it's through relations, whether it's through history, land. In an Aboriginal Torres Strait Islander community, it's even more important that the person that they come and tell their deepest stories to is someone that the community feels that they can trust.
So one of the real challenges here is that we have a serious gap in healthcare. That gap is not just in the health of the Aboriginal community, but it is also in the digital divide. So these communities are not as digitally enabled as they could be.
Some of the challenges while living remotely for the clients would be like lack of internet, not having the understanding on how to use an iPad.
The internet might not be good, the phone reception might not be good.
It's important to talk about connectivity, particularly in the remote communities, and it's important to talk about the access to specialist care or care in general in communities.
Communication, it really relies on technology in the 21st century. The challenge for me has been how do you use these tools in places where there's no connectivity?
I think a lot of people who live in regional and remote areas don't want to come to the city for treatment if it can be avoided, and if those treatments are available on country or closer to home, they would much prefer it.
And also I think people are afraid to come away because they see people travel for treatment who don't necessarily always return home, and so then that creates even further fear that if I go, I'm not going to come home either.
I've heard a lot of stories about people going to Perth. Some say, oh, well, don't go to Perth because you'll end up coming back in a coffin.
It may be a hospital, but to me, it's not a healing place. My healing place is out in the bush.
One of the fascinating things about Aboriginal culture is that for thousands of years they've been custodians of data. Communities that, almost by second nature, understand the importance of transmitting information from one generation to the next.
Aboriginal people have been asking for their information to be shared, and this was a long time ago before we had the digital technology we have today. It's really, really important because if we have to move and go from place to place, from hospital to hospital, all our information follows us through. And that's allowed people to not have to worry about having to explain again what my condition is.
Every Australian should have equal right to healthcare no matter where they live, and they shouldn't have to choose where they live to get that. If Aboriginal people choose to live on country, in remote locations, they have the same rights as every other Australian.